Our guest speaker is Mr. Anil Raj. He is a research scientist, also has his MD from the University of Michigan School of Medicine, getting that degree in 1990. He followed his general surgery internship as a contract general medical officer for the U.S. Army for 1 year. He's got interest in all sorts of things, folks, but I'll tell you this, he understands ketosis, he understands Ketopia and what we are about. He understands the power of ketones, and we're very, very excited and thrilled to be able to turn some time over to Mr. Anil Raj. Are you on the call with us, Anil? Excuse me.
Yes, I am. Can you hear me?
Absolutely, we can hear you. So we're excited to have an opportunity to hear from you tonight. I know that you've got some excitement around ketones and obviously nutritional ketosis versus the misconception of ketoacidosis. So we will turn some time over to you. I may interrupt you along the way and ask you a few questions, as may Ron, our CEO and founder. So with that, let's turn the time over to you. Thank you so much.
Well, thank you very much for the invitation. I appreciate an opportunity to talk to your team, and I'm also very excited about the availability, or the near-term availability of effective ketone supplements. Personally, I've been on a ketogenic diet for the bulk of almost 4 years now. It led me to lose about 35 pounds that I'd gained since graduating medical school. And I feel much better about myself for doing that. But I understand it for me and for other folks, it's sometimes difficult to maintain that diet. We get the old mayonnaise malaise of just getting tired of eating that much fat. And I'm looking forward to having some opportunities to try out and evaluate true ketogenic nutritional supplements that will get a good ketone level in the bloodstream and be able to maintain that with a little bit easier choices on the diet. Now, I am involved obviously with Access Global with their new quad salt and medium chain triglyceride formulation, and that's what our primary goal is this summer, is to determine essentially the peak levels that are achieved by the standard recommended dosing of their new preparation, and then how long is that peak level maintained, and how quickly does it return back to baseline. So we'll be looking at actual blood levels in a number of participants this summer, and looking to see if we can characterize the relative increase in blood ketone levels following ingestion of the Access Global product. Now, you mentioned something about the nutritional ketosis versus ketoacidosis. Nutritional ketosis, as I imagine many of your callers are aware, is something that is a natural state for the body. It is something that happens when the amount of carbohydrate is limited in the diet, and the liver will go ahead and convert over and create ketone bodies that are actually preferentially taken up by a number of tissues in the body and are actually more energy efficient for cellular activity. So it's actually a great place to be metabolically, and it also helps with losing body fat, because you're able to get the stored fat released back into the bloodstream for fuel by reducing the amount of insulin that's in your body. Now, with ketoacidosis, that might be associated with somebody who has diabetes. That's a little bit different animal there. That's a actual response to the lack of insulin, circulating insulin, and that causes the failure of glucose to get into the cellular energy engine, the mitochondria, and it causes the liver to chunk out quite a bit of ketones, a lot more than what we expect to get to with nutritional ketosis, and that because the ketones themselves are acids will cause the acidosis component of the ketosis that is associated with diabetes. And so we're well below the levels of ketones in the bloodstream that you would expect for ketoacidosis when we're in nutritional ketosis. Now, what we're hopeful to do is that without severe carbohydrate restriction or without starvation and just severe caloric restriction, hopefully get reasonable levels of ketones in the blood that are a quarter or less of what we would expect to see with ketoacidosis in a diabetic. And so we're not even close to the ranges that are associated with kind of the pathologic ketone overload in the blood from diabetes type 1, but we'd be looking at trying to raise it at least as high as what you would get with starvation or severe carbohydrate restriction, or perhaps exceed that slightly. And that's what we're looking to see, is just how close are we getting to our ideal nutritional ketosis levels with the new supplements that are becoming available.
Dr. Raj, thank you so much for sharing that information. If you could, and maybe you touched on it briefly, but if you could, tell us a little about this study that you're working on, and what are the hopes and aspirations of this study as it relates to ketones in the body, etc.
Okay. Well, the ketone preparation that Access Global is manufacturing currently is a new salt of ketones. So essentially it is a powdered substance that's mixed in with water, because the salt makes it water soluble versus some of the other ketone esters that are out there, which are not water soluble, and they're very greasy and fatty. And I've never tried one, but I've heard they just taste awful. It's a lot of volume, and it's a very uncomfortable thing to ingest, versus the salts, which can be made water soluble, which means you can put them into drinks, dissolve them with flavorings, and make them much more palatable, much more along the lines of a power or an energy drink or something like that. That is not going to be difficult to ingest, and is also not going to be nauseating or requiring such a volume that it's difficult to get a sufficient dose on board. Now, the salt itself, or the compound, has got sodium, calcium, magnesium, and potassium salt compounds of ketone bodies. Plus, it also has some medium chain triglycerides in there. And what we're hopeful to do is get a single dose in the manufactured package to generate about, if not 3 times a starvation level ketosis in the bloodstream within about a half hour of taking the supplements. And what our goal is to see, do we get to that half hour point and hit the peak, or is it extended beyond that, or is it happening earlier? And then how long does that ketone level remain above the baseline for every individual that we test? And we'll be testing about 25 people this summer, and the goal on this particular study is to generate that information such that we can understand how consistent the product is across different individuals, and then with that information we'd be able to generate hopefully a journal paper that we would submit for a publication in a scientific journal.
Fantastic. I'm very familiar with those journals, and this would be fantastic to be able to get that sort of particular study and the results of that study published in a reputable journal. So we appreciate you very much, Dr. Raj, for jumping on the call tonight. Again, there's lots of excitement around ketones and ketone bodies in the blood, and the ability, in this case, to have our ketonic strength and be able to have that go into our bloodstream, and within 30 to 59 minutes, be able to test that and know that we're in ketosis, and we're very excited for that. And we really appreciate you taking time out to be on our call, and we thank you very much, and we thank you for sharing this wonderful content with us.
Okay, well, thank you very much for the invitation, and have a good evening.